This holiday season, eat well. Just don't go in for seconds and maybe avoid those carbs. Here with those tips and a whole bunch more to keep you physically fit and trim this holiday season is Dr. Lance Simkins. Dr. Simkins, it's good to see you. Welcome to our show.
Thank you. Happy to be here.
So what's great about this is not only are you an interventional cardiologist, but you're also board certified in obesity medicine, which is pretty rare, right, for a cardiologist?
Yes. Today we're hoping that will change.
Okay, which makes you an expert in what we're going to talk about. And we're talking right now specifically about Thanksgiving and calorie intake. And you have a really interesting personal story that sort of shaped how you feel about how people should be eating, right?
Exactly.
Go ahead, share with us.
So I've been a board certified cardiologist for a long time, almost 25 years, and have always cared about health and getting my patients healthy, but I've had honestly very little success over the years doing it and actually having people follow what seemed to be so obvious to me, the classical low-fat, low-cholesterol diet that we've recommended for so many years, and it frustrated me. But I kept trying, and 4 years ago, tore my knee playing racquetball, trying to stay healthy and exercise, and had surgery and put on a little weight. And for the first time in my adult life, I couldn't get it off and realized how hard it can be, and literally stumbled into a program that I did and learned the power of small, frequent meals, and I love that. So I lost weight, actually got back to my high school weight for the first time in 35 years, feel 10 years younger, and have kept it off for almost 4 years. Having done that, I learned that there are many different ways to approach this, and I wanted to go back and learn everything, which is why I pursued the board certification. And now we help a lot more people, but my approach has changed. No matter what approach people take, I believe in small, frequent meals, and that definitely applies to the holidays. And I actually started this whole process the weekend before Thanksgiving.
And
so
what's really interesting about it is you are a proponent of low carbs as opposed to low fat and low sugar, correct?
Correct.
Okay.
So I have shifted as a cardiologist from the traditional low-fat, low-cholesterol diet that we were raised on teaching people, and learned that it's just too hard, and I have shifted to a low-carbohydrate approach. And first of all, to be clear, any diet works. You can lose weight on any diet. What I believe that I've gained insight into is that the relationship between carbohydrates and sugar's effect on your brain and your hunger centers is far, far more complicated, and we're just beginning to understand it, and those carbs can be addicting.
Are we talking brown rice, whole wheat bread? Is that okay? Because I've had this conversation with, as you can imagine, numerous experts in different fields, and everybody has a different opinion on it. Personal trainers and doctors, right? You know this.
I hear you.
Okay, so whole wheat pasta, brown rice.
Okay.
How are we with that?
Okay, so probably will generate some hate letters.
Let's hear
but
it.
I'm willing. So all of those, first of all, most of those carbs that you're describing pretty much are healthy. There's really nothing unhealthy about rice or pasta or potatoes or any of these things. But unfortunately, it's the effect on your blood sugars that we're talking about here. And even whole wheat, whole grain products that we use that are healthy, that have a lot of fiber and vitamins and good health benefits, when we're talking about your weight and getting to a healthy weight, it makes it difficult for most people, is what I'm finding. Now, once somebody's at a healthy weight, absolutely, I want them to incorporate back whole, healthy grains like you're saying. To be careful, though, not to regain, and find out how much you can handle without regaining.
This is so depressing. It's so disappointing to hear. We will talk about Thanksgiving. We're going to have some Thanksgiving tips, but one more carb tip. So, okay, so what does that mean? So if someone's slightly overweight or obese or whatever, and we want to stay away from the whole wheat stuff until we've stabilized, but do they have to eat some carbohydrates? Are there okay carbohydrates to eat? If so, which ones?
So you just asked two different questions.
Okay, fair enough.
And it's a great question. So the answer is no, you don't have to eat any carbohydrates. We don't need carbohydrates to live because our body can generate its energy from other sources. Having said that, I favor eating lots of vegetables as your carbohydrates when you're losing weight, and then carefully reintroduce the starches carefully back into the diet. The trickier one is fruit, because fruit is extremely healthy but also extremely high in sugar. So it has to be also carefully watched while you're losing weight. That's the first thing I encourage people to bring more of back into their diet when they're at their healthy weight.
Okay, so Thanksgiving, there will be carbs, there will be fruit.
There will be carbs.
There will be everything. I mean, let's be honest, it's gluttonous.
Okay.
Give me a few of your personal tips to surviving and thriving, or at least not breaking the pants during Thanksgiving.
So my challenge to people is to become a connoisseur of food. Really love your food, but not love quantity, but love the quality. So I actually started this the weekend before Thanksgiving and then through the holidays into New Year's, and was able to lose significant weight over that time by, number one, never show up hungry. So don't show up to your Thanksgiving dinner hungry. You don't want to do that because all bets are off. Whatever is put out there, you will grab. If I'm hungry, I gotta eat. So actually having a piece of fruit or a handful of almonds, something before you get to your event, your party, is really smart, so you're not emotionally hungry when you get there. The other thing is what I did on Thanksgiving was I planned to have a few naughty things that were carbohydrates because I chose to, but I limited myself to one plate of food. So there were no seconds, and I knew that in advance. So I took one 9-inch plate of food, and I organized it where I decided I wanted to try the sweet potatoes, the sweet potato pie, or a little bit of the stuffing. I took 1 tablespoon of each. I ate it really slow because there was really little bit there in my plate, but I had a small bite. I put my fork down. I took a drink of water. I picked up my fork again. I had another bite. And I really savored every bite.
What is the medical answer to this? I know I've heard your body needs a little time to tell you that it's full, right? Like you might be full, but you keep eating, whereas if you just wait a few minutes, your stomach will just say, I'm good here, right?
So that's a great question. My answer, is that actually you don't want to be full. If you are full, you've eaten too much.
Okay.
So the answer is, the trick is to eat till you're no longer hungry.
Great.
And that's what you're referring to as taking time. So sugar gets absorbed pretty quickly into the bloodstream, and it releases chemicals in the brain that give you pleasure. Fats, however, and proteins digest a little more slowly. It takes longer. They get absorbed a little lower down in the stomach system, the GI system, and releases different hormones that later on feed back to the brain, to the fullness centers, the satiety centers. And so yes, if you eat your meal slowly and really enjoy it, you're much more likely to feel satisfied with less volume.
Great. We're out of time. I want to spend 10 more minutes on this. I have so
come
many more
back.
questions. Okay, I have more questions, which means our viewers obviously must have more questions. How can they have them answered? How can they find you and contact you?
I'm not hiding.
Okay.
My office, I have 2 in Tamarack in Broward County, and in Palm Beach County we're in West Boca. The phone number is 954-721-6666. Pretty easy to remember, and we're happy to help.
Well, it's good to see you, and you are actually changing the way that I'm going to eat, particularly on Thanksgiving. So nice to see you, Dr. Simkins.
My pleasure.
You got it.